And during the last couple of years, introduction of the quadruplets, which means PI and IMiD plus a monoclonal antibody targeting CD38, has produced remarkably well results. And even as in such as the Manhattan study, without having stem cell transplant in the protocol, the patients have been able to achieve similar outcomes comparable to those who have received a induction with a quadruplet and a stem cell transplant. I think the question stays here for the number of cycles prior to the transplant. With analogy to the Spanish data published earlier, increasing the number of induction cycles, you may end up achieving similar results with a quadruplet with shorter cycle numbers. So I think having made a decision to decrease the costs and give longer periods of less intensive therapy versus shorter course of more expensive and more intensive therapy, that is a question. And currently, stem cell transplant is the cheapest treatment worldwide, and not all the quadruplets are approved in all countries. So for the majority of the countries, I think the triplets followed by a stem cell transplant will continue to be the main treatment approach for newly diagnosed myeloma patients. However, for those who are able to consider quadruplet for induction and achieve MRD negative status prior to transplant, for those patients, some authors are reserving a position for delaying autologous stem cell transplant to a time when the disease relapses.